I've asked my doctor about liquid biopsies for the last 10 years when I first heard about them because I'm in Silicon Valley. I'm at the cutting edge of every new technology that comes out. And I'd heard about these tests being developed, and I've been asking for year after year, when is this commercially available? Because, that sounds a lot less intrusive than a colonoscopy that you want me to get, and things like that. And it was always no such thing. It doesn't work. It's not available yet. My name's Roger. I'm a lawyer. I do startups and venture capital in Silicon Valley, California. At the time, I didn't think anything was wrong. But looking back on it, let's say I had no symptoms, but I did have signs. All right, there were clues. And the one big one that I completely missed, and my two doctors missed entirely, was that my blood sugar increased just slightly. And I noticed it. My blood sugar has always been exactly where I want it to be. And I went in and I got blood tests, and I noticed it was up a little. And I said, "Hey, doc," I said, "what's up with my blood sugar?" She said, "Well, that just happens. Fasting glucose is kind of all over the place. Your A1C is fine, probably doesn't mean anything." And I said, "Well, it must mean something. It's higher than it was before." She said, "Well, we'll come back in 3 months and test it again." So I came back in 3 months and it had gone up even more. And I'd lost 5 pounds in the meantime because I thought maybe it was because I needed to lose some weight or something. And I Googled it, of course, and that was my first clue because there's like a million things that could cause that to happen, one of which is pancreatic cancer. I know now that that always happens with pancreatic cancer, weight loss and blood sugar increase. I didn't know it then. But so I had a clue, but still I had no symptoms, I had no pain, had no fatigue, had none of the stuff you read about. Um, so I was just setting baselines when I got tested. I'm just like that. I just really want to test for everything. I want to monitor. I want to keep track and pay attention to these little itsy bitsy changes, like in my blood sugar. So when I got tested for in my liquid biopsy, it wasn't because I had some. I didn't even have really any risk factors either. It was simply to set a baseline, and the doctors characterize this as no symptoms. So I used a blood test by Galleri by Grail. We call it liquid biopsy. I've asked my doctor about liquid biopsies for the last 10 years when I first heard about them because I'm in Silicon Valley. I'm at the cutting edge of every new technology that comes out. And I'd heard about these tests being developed, and I've been asking for year after year, when is this commercially available? Because, that sounds a lot less intrusive than a colonoscopy that you want me to get, and things like that. And it was always no such thing. It doesn't work. It's not available yet. You can't have it. FDA hasn't approved it. Well, one day I was sitting on an airplane in April of 2022 reading Tony Robbins' book, and it mentioned the Galleri test. And it says, here's a blood test that can detect 50 different cancers. And I made a mental note. And as soon as I landed, I went to the website and I started investigating. Now, it took me a couple of months to actually get that test because a doctor has to prescribe it. I mean, what we mean by that is they take blood and not tissue, and they can examine it and look for protein markers using strong AI to assist it that will identify markers of different types of cancers and the tissue of origin. And I got that blood test. Took about a couple of weeks. I got the results. The doctor called me up and said, "Look, we found some signals for pancreatic or gallbladder, or it could be stomach or esophagus, and you should do further testing. Doesn't mean you've got cancer; just means we found strong signals, especially for pancreatic cancer." And based on that, I went in for an MRI the very next day, by the way, and they found a mass on my pancreas. It took about a week. And based on that, I went into a CT scan and a biopsy where they actually, well, it's a tissue biopsy where they actually examine the tissue. and that confirmed a diagnosis of stage 2 pancreatic cancer. They considered it to be unnecessary testing because, oh, I'm so young and healthy and I got no symptoms. Well, the thing about pancreatic cancer is once you got symptoms, it's pretty late stage. You'd kind of like to catch these things before you get symptoms. But I pushed ahead and found a telemedicine doctor that would prescribe the test, and that's how I ended up in it. So I got the Galleri test. We got the blood markers, and like I say, it was easy once I understood the process. It's just that this process is very mysterious. It's not. I can tell you right now that primary care physicians, at least 2 years ago, were not out there telling everybody in the world to get this. Unless you've got concierge doctors, you're probably not hearing about this. Um, so I had to figure it out for myself. And once I did, I got the Galleri test. Well, then the next step is to do scans. Well, again, you can go into your hospital and you can wait around until they come back from vacation and get around to scheduling you. Hopefully they've got the personnel to do it, etc. I didn't do that. I went the very next day and got a private scan from a company named Prenuvo, which is right down the street from my house. um, and so I was able to get that scan right away. But after that, then I had to get into the system because then I needed more sophisticated things: CT with contrast, biopsies, endoscopes, stuff like that. What I heard from my primary care doctors was mostly quit bugging me about this. It's not serious. You're not diabetic. You're not pre-diabetic. So it's gone up a little bit. You're getting old. Stuff like that's going to happen. You have no symptoms, and I'll never forget these words. That is unnecessary testing. Um, Boy, it was not unnecessary at all. Well, that was the frustrating part because I fired my first doctor because he wouldn't give me anything preventative. His attitude was very much come back when you're sick and quit wasting my time if you're not sick because I've got sick people that need me. And I guess I'll admit, maybe I'm a little of a hypochondriac. I want to check out every little thing. It's just my personality. So I found an institution that advertised that they were all about preventative care. They're all over the TV, all over, a lot of advertising promoting that. And I said, great. And I went into them and yeah, they were preventative provided I told them what I wanted to do. What I liked about them is at least they didn't say no, but I still had to tell them what I wanted. So like I told them long before this happened, I gave them a list of blood tests that I wanted. you know and that is the one big message I would like people to have. um, your health is just too important to trust to a doctor. As odd as that sounds, and as much as it pains me to say that, it is my personal experience that health is too important to trust to a doctor. You have to take charge yourself. You have to tell your doctor what tests you want run. You have to tell your doctor what you're concerned about. You know your body better than anybody does. And if you think just even subconsciously that there's something going on that shouldn't be, you need to tell them because you as doctors, and I don't blame doctors for doing this, they're not trained to keep you from getting sick. That's not their job. It took me a long time to realize that because I was very angry for a long time. Like a lot of cancer patients, I was angry. It's like, how could you let this happen to me? Until I finally came to the realization that, hey, it's not their job to keep me healthy. That's my job. This is my failure, not theirs. Their job is to fix me when I'm sick. And that's why I kept hearing from them, come back when you got symptoms. So big lesson, find a doctor that's willing to work with you and prescribe what you need to take care of your concerns, but then go out and self-educate and make sure you're covering all the stuff that is silent, all right, or symptom free. Yeah, I went through all of the stages of grief in about 12 hours, I think. Bargaining, anger, whatever they are, sadness, acceptance. And the good thing and the bad thing is that we've all got, search engines and the internet, and we can go out and research this stuff. And the conventional wisdom about pancreatic cancer is that American Cancer Society says it's incurable and fatal. And, stage 2, life expectancy about 1 to 3 years on average. And even some very good doctors, you read what they say online. Peter Attia has said, I've heard him say 3 times now, that pancreatic cancer is a death sentence at any stage. And he was surgical oncologist at one time. And I heard that from a lot of other doctors too online. What I came to discover, however, is that all of those doctors were looking at backward looking data, right? Yes, that's been true of, the studies that have done so far up till now. And plus that data is kind of old because you got to wait 5 years to find out what the 5 year survival rate is for somebody. And the message, and the second thing I guess I'd like everyone to know, and the second thing I figured out is that the statistics um, are really bad. The stats are bad, but those stats are based on standard of care, United States standard of care. Those statistics are based on what we've done in the past under US standard of care. They're not based on what's going on going forward and what's out there in the future and what's beyond standard of care. And also, statistics are very misleading because you have to make generalizations, and as someone told me early on in this, I talked to a lot of survivors and a lot of patients. And one of the pancreatic cancer survivors I talked to, one of the few who made it, he was 12 years at the time since his diagnosis. He said, really, you have to think of yourself as a statistic of one, because every person is unique, every cancer is unique. Even within the cancer, it's going to be different than any other cancer. So it's hard to generalize and place all of your faith in those generalizations. So I was able to get admitted into Stanford Health and also into USCF in San Francisco. They both have very well respected oncology departments. And I will say that I think I had just top quality care from my doctors. I am very grateful to my doctors for what they've done. So that process, but it wasn't easy because this was at a time when everybody's overwhelmed. I think our US medical system is just generally overwhelmed, and it's just hard to get attention to get in. And again, this is where the patient has to be CEO and has to take charge. You have to be very, very assertive about these things, and I was very, very assertive. And once I did get in front of an oncologist and they saw the numbers, they saw the scans, they saw the blood tests, then everything changed. Then all of a sudden I was urgent. And because pancreatic cancer is very aggressive, very fast moving, you can't wait 2-3 months to go get a scan. You could be dead in 2-3 months, right? So they moved me along really quickly, put me into treatment quickly. Now, one thing I will say about that, and I like it this way, is the doctors I had, and I talked to lots of them. Second opinion isn't good enough for me. I bet I talked to a dozen oncologists before I decided on anything because there are a lot of different options. And it's all up to the patient. Are you going to get chemo or not? You, the patient, have to decide which chemo are you going to get. There's about 6 or 7 different kinds for this, and we're guessing at which ones might work. When are you going to have surgery? Are you going to do it now? Are you going to do it in 3 months? Are you going to do it in 6 months? How many months of chemo are you going to have? Had all of these decisions. And the doctors would have opinions, which almost always varied, even within the same institution, would vary. Oh no, you should do 3 months of chemo and surgery. You should do 2 months and then surgery. You should do 4 months. You should do 6 months. So ultimately, at one point, I just asked my oncologist, I said, wait a minute, are you telling me that this is up to me? And he says, yeah, I'm afraid so. You tell us. You have to decide. These are your options. This is what I recommend, but these are your options. So it pays to be well advised and well informed. I had every side effect that you could possibly have from the chemo. My oncologist said the first thing he told me is when I met him is he said, I want to apologize in advance for what I'm about to do to you, which is not a great thing to hear, right? And he said, we're going to be very aggressive about the chemo because you look like you're strong enough to take it. And the thing about chemo, like most medicine in the US, you give the minimum effective dose, right? With chemotherapy, it's the maximum tolerable dose. Well, it turns out I can tolerate a lot. So I had 6 months of just pure hell. I mean, it was pretty miserable. It looked like I'd aged 20 years, and I'm almost back to normal now. But it was super unpleasant. And so every side effect plus some they'd never seen before because I was getting a lot of this stuff. And some of this is still with me. I still have some neuropathy. I still have some other things, but I'll get over it. I'm confident that I will heal. Uh, and it did things to my arteries that they said wouldn't, well, nobody made me any guarantees, but some things to my arteries I did not think would happen. But I will heal from that too. I will get over all of this. But to combat the side effects of the chemo, I was given a whole bunch of drugs and painkillers and anti-nausea and anti-this and inhibitor that. I didn't take any of them. It's like, you know what? The chemo's enough. That's hard enough on my liver. I like my liver and my kidneys. So I didn't take any of those drugs. I said I would rather just lie here on my bathroom floor for a week and suffer than take any more drugs. And that's what I did. And I don't recommend that approach to anybody else other than a masochist like me. According to the pathology report, there was no treatment effect. So we switched chemo. I had 3 months of chemo, surgery, and 3 more months of chemo. So we switched chemo to Gemzar, gemcitabine, and I ended that in February of 2023. And I don't know, who knows what worked. I mean, there's so many confounders because, like I say, as I sit here today, I am cancer free, at least for now. And you might ask, why is that? Well, I can't tell you. It might have been the chemo. It might have been having surgery at the exact right time. It might have been metabolic factors. It was no doubt partly lifestyle changes. There's a million things that could have contributed to this. And the way I look at it is cancer is a very complex group of diseases. It's not one thing. And therefore, the cure is not going to be any one thing. It's going to be, I guess, multimodal, right? It's going to be a lot of things. One of the things I did that, again, I'm talking about forward-looking technologies, not backward-looking. And one of the things I've done that is very cutting edge and forward-looking, even though it's been around for 10 years, is a cancer vaccine. And the vaccine that I got, I went through after it took me a little while to find people that do this legitimately and are not out there just trying to steal money from dying cancer patients. But I did find groups that do this legitimately. And I received last year a neoantigen peptide vaccine. I also received NK cell expansion therapy and dendritic cell expansion therapy, as well as some other things. I'm going in fact, next month, I'm going in for a second round of a different set of targets. Same concept, neoantigen peptides. And I really think that's the future. That is the cure. That is the cancer cure. That's the future. Because chemo doesn't kill all the stem cells, right? And it always stops working. Everyone knows that, right? Radiation is not a cure. Even my radiologist told me that. Surgery buys you a little time, but there's micrometastases, and that's not going to be an option. So really, we have to train our own bodies to deal with this. And and the way I look at it, I mean, how did this cancer start? Well, it was an evasion of my immune system. So I think where we start is by strengthening the immune system. I think if anyone is really considering getting a cancer vaccine, I went to Japan to have mine, the first round anyway, because they're not subject to FDA rules, so they could move more quickly. And with pancreatic cancer, it's important to move quickly. And a surprisingly high percentage of people that pay for this vaccine in the US end up dying before they get it because it takes so long to get through the FDA testing protocols. I didn't want to wait around and guess. So I went to Japan and I got it done quickly. Importantly, the physician I chose there also has his own lab. And that's really important. So the administering physician, also could get it from his own lab. So I didn't have to worry about any disconnect between those two components to it. And so that was, once I figured it out, it wasn't that difficult. But figuring out which vaccine, which lab, and then you got to find a company that finds the peptides, right? In a peptide, it's just a string of maybe 9 amino acids. But believe it or not, the technology now exists. It's out of pocket. All of this is out of pocket, and it is very expensive. And I acknowledge that it may be just simply beyond the reach of a lot of cancer patients. And the reason it's out of pocket is because it's not FDA approved. And I don't understand why. I honestly do not understand why. There's no downside. This is not like a drug. It's not like a checkpoint inhibitor. Turn on your body and turn your immune system against yourself. It doesn't do that at all. You're using your own cells. I don't get it, and I've written the FDA. I've testified to the FDA. I've been like beating the drum that we really need. Now I'm getting this vaccine in the United States under an expanded access application to the FDA. They also call that compassionate use, and that is an approach, but it's another big red tape bureaucratic process that we should not make people go through. And it's unfortunate that it costs so much. Now, I will tell people who are considering this that to get it in another country, you can get the exact same vaccine for a fraction of the cost. It's about one-fifth the cost to do this in Japan than it's costed me to do this here. And it's the same vaccine. The way I look at it, so cancer, I look at it like there was a fire in a house, and the Galleri test and the pre-nuvo test, they found the fire. Okay, and I called the doctors, my firemen, they came in and they put out the fire. But they didn't leave me any fire extinguishers in case this happens again. And they also didn't bother asking, gee, why did that fire start in the first place? Well, to me, the vaccine is the fire extinguisher. If this does, if those cancer cells are still in my body, the vaccine is going to find them and snuff them out. But more importantly, what did I do to make this happen again? Now, if you ask that question, doctors and my doctor said this over and over, this isn't your fault. There's nothing you did. It's just luck of the draw, bad luck. It's not your fault. It wasn't because you ate too much sugar or you drank too much or you didn't exercise. It's just bad luck. Well, okay, there's a large component of that that's true. A lot of it is luck. But on the other hand, I do believe there's a cause for every effect. And I had to go back and say, what could I improve in my life that would, make my body as inhospitable as possible to a cancer cell? And I made major, major changes. My diet is much different now than it used to be. Right, it is anti-cancer diet as they come. I wear a blood glucose monitor. I'm not diabetic, but I keep my blood glucose is now lower than it's been in 10 years probably. I exercise a lot because that is probably the number one thing. Heavy exercise studies show reduce the risk of cancer recurrence by 50%. 50%. Tell me a chemo drug that does that. And then there's supplements. There's cortisol. There's a lot of things. Sauna, heat therapy, I think helps because that creates. I learned that in Japan. That creates heat shock proteins that a normal cell can manage just fine, but a heat shock protein to a cancer cell completely messes it up and makes it visible to your immune system, or maybe just kills it through mechanical stress. And the big one, though, that where people say I might have gone a little overboard on this, is cold therapy. I've really gotten into cold therapy, cold water, ice baths. In the wintertime, I'll go run, in the snow, with just my running shorts on, as long as I can stand it. And I think it helps. I think the cold therapy has made my immune system a lot stronger than it was. And it also increased the brown fat in my body. And I've got the DEXA scans to back that up. and that has reduced my blood glucose, which means that it's less likely that these sugar hungry cancer cells are going to get all the nutrition that they want. Being your own advocate is super important, and you just have to be assertive. You have to be super assertive about this. That's hard for a lot of cancer patients. You've heard about the type C personality. I don't know if there's anything to that or not, but it's hard to, kind of demand that your doctor do stuff. When they're the expert, what do you know? But you just got to be your own advocate, and you have to self-educate. Number two is, if you do standard of care treatment, you're going to get a standard of care result, and that's all those bad statistics you're looking at. Those are all standard of care statistics. You got to be willing to go a little further than that. So, and then the third thing is don't lose hope, right? Because the things are moving so quickly.